On the far left, we have Ed Lamphere, the CEO of Sangamo Biosciences. Next to him, Fariba Ghotsian, the managing member of Daphne Capital Management. Next to her, Steve Rozak, the CEO of WBB Securities. And a guest panelist who's not on your agenda, who's able to fill in today, is Andrea Hunt, the Vice President of Cellular Therapies for Baxter Healthcare. And finally, we have Paul Kim, the Managing Director of POSCO Global Strategic Fund and the CEO of Pocustem. So with that, why don't we just start with each of you giving a little bit of your background. I think that will really help set the stage for the agenda that we're having today. Ed, why don't you begin?
Happy to. Edward Lamphere, Sangamo Biosciences. I've been at Sangamo for coming up on 20 years. Before that, I was involved in several biotech startups, but the one previous to Sangamo was also a gene therapy company. So I've been in the cell and autologous gene therapy space for about 20 years. Beginning of my career was in consulting, and then Eli Lilly in strategic business planning.
Thank you. Fariba?
Hi, good afternoon. Can you hear me?
Yes.
Okay. I started my education on the engineering side, chemical engineer, and continued to do my PhD in biomedical engineering. And I worked in the pharma biotech industry and worked on the research side and business development. And then I went to Wall Street in 1994. And gene therapy and cell therapy was one of the areas that at the time I covered companies like Cell Genesis, Wykel, and so forth. And later on, I joined, I started with Bush Morgan here in Los Angeles, and with Hancock, and then with Lehman Brothers. And my last sell side position was with Roth Capital. And after that, for the last 10 years, I have been managing Daphne Capital, a long-short fund based in Los Angeles, and we cover biotech and medical devices.
Thank you. Steve?
Good afternoon. I'm the president and managing director of WBB Securities. We're an independent broker-dealer that's bi-coastal, although I don't know right now about the East Coast and how it's handling what I'm going to go back to, but basically we've placed about $1 billion worth of securities in the healthcare field over the last decade. We run investment banking focused specifically on biotechnology, and under the small firm exception, we also do research, which is in the biotech, especially pharma, and med device space. And so been doing it now for roughly a quarter century, which is probably way too long, but we've had a chance to see just about everything from the microcaps becoming multi-billion-dollar companies, and to be able to say, I remember these people when they were just poor millionaires. The realities are that looking at it, you have to understand, as you well do, that the opportunities are there. It's just that they're not uniform, and they come in different ways than you expect. So that's the perspective that I'll be bringing in today.
Thank you. Andrea?
I'm Andrea Hunt with Baxter Healthcare. I've been with Baxter for more than 20 years, working on a variety of innovation initiatives under our Chief Scientific and Innovation Officer. So have had responsibility of running sort of our internal incubator initiatives within Baxter, and that led me to my current position, which is managing our cellular therapies business within Baxter. We're involved today in clinical trials in phase 3 in the cardiac area, and also in the vascular side as well. But I'll speak probably more from just what we see within Baxter and how we look at bringing in new initiatives and those kinds of things. I hope I can bring that to the panel.
Thank you. Paul?
My name is Paul Kim. I'm with POSCO. POSCO is a $45 billion steel conglomerate that's based in Korea. May have a probably the most unique investor in biotech space, but the truth of the matter is, actually, POSCO Fund started here in San Diego about 10 years ago. I was one of the founders of the fund. At that time, The fund invested broadly across the different areas of biotech, but starting last year, we made a strategic focus in regenerative medicine. And the reason for that, I think I can give to you in a little more detail later on, but we have an equity investment entity, which is the venture capital fund that POSCO is the 100% LP in. But we also have a company called POGA-STEM, which is it's the fund's dedicated development entity, where we invest in a company and then we take that company's product or an asset and develop it through POGA-STEM, leveraging a lot of the clinical infrastructure and the advances in regulatory development in Korea. Korea has really become a leader in the stem cell therapy industry, having been the first country to commercialize stem cell products in the world. They actually have 3 products, one of which that company I think is here in the audience today, a company called PharmaCell. So we'd like to leverage a lot of what the Korean industry in the stem cell has achieved over the last several years and leverage that with our investment tools that we have at POSCO.
Hey, thank you, Paul. I might add, I'm actually the president of Emerging Growth Fund as well, Oxford Capital. So if you look at the panel, we have 3 funds represented, current CEO and old CEO, and we all know all CEOs are always out there looking for money.
I'm the only one here looking for money. You guys,
No,
that's great.
in case you don't know about where funds come from, we're all looking for money. So, and then investment banking with Steve, and then the industry perspective from what companies such as Baxter looks to see in investing and being involved with new technologies. Well, one thing I've learned from over the years of being involved from both the CEO side and particularly from the public side, as well as now on the banking side, is a keen understanding that achieving shareholder value is as much a capital markets decision as it is a technology decision. And I think back in the origins of regenerative medicine and stem cells, we all used to get away with, what's your company? We have stem cells, we have stem cell technology. Okay, great, and that generated excitement by itself. But that as a value proposition doesn't work anymore. You need to really be able to lay out a number of things, and that's what we're going to talk about today a little bit in different ways, what that value proposition really needs to be to look to generate value. Because if we don't generate value, we're not going to raise money, and investors aren't going to invest in this space. And I think careful attention to that of matching up a capital market strategy and plan with an operational plan and a technology development plan is absolutely critical for this space, as it is for all emerging growth companies. So that's what I'd open this up a little bit, and I think the first topic around that is going to be just to see what do we think amongst the panel the investment climate is for money coming into the regenerative medicine space. So why don't we start with the funds, and maybe talking a little bit, if we could divide it up, thinking about what that might be for early stage companies, mid-stage companies, and some later stage companies. Because one of the nice things, as Steve, I know I'm going to steal your bullet a little bit, give you credit, but you'll talk about it, is this industry has moved where we have some late stage companies. We have companies that are now in late stage trials, and so that investment question is a bit different for these different companies. But why don't we start with Fariba, you, and just a little bit of what you think the climate is for investment in this space.
I guess just to make sure, when you talk regenerative medicine, you're more talking about stem cell companies as opposed to also other cell therapy, or because let's say Dandelion is a cell therapy but not stem cell, and obviously they're already on the market, so kind of.
Well, for me, I think the critical question is, I would say emerging growth cell-based therapies. I don't think there's too much at this conference represented by chemical wound healing products and things of that nature. So maybe cell-based regenerative medicine, cell-based therapies.
So let's say the Endurance type would be
That
included
would be
in
fine.
that sense. Okay, okay. But, I mean, you know,